Hi, I'm LoriBenold with Empower Brokerage, and we're so happy to be here for this Shop and Compare event with Connected Senior Care Advantage. I'm here today to give you a Medicare 101 overview, and I want to start with the 3 C's. You know, Medicare is complicated, and because of that, it's confusing, and because it involves your health, it's really concerning. And we understand that and want to be of help to you. So let me start by telling you a little bit about Empower Brokerage. We help thousands of people like yourself across the country find solutions to their Medicare-related needs. We have a national call center, bilingual support. We represent hundreds of carriers throughout the country. And most importantly to you, we have a local team of experienced advisors here in the Austin area who are dedicated to working closely with Connected Senior Care Advantage. So let's get started. What do you need to know? First of all, you need to know what Medicare is, what it covers, how much it costs, can you afford it, are there other options, and what other benefits are available? So let's start with the first question. What is Medicare? It's a government health insurance program, and it serves 3 groups of people. People over age 65, people under age 65 with certain disabilities, and also people of any age with end-stage renal disease. All right, Medicare is administered by the Centers for Medicare and Medicaid Services. Sometimes you'll hear that called CMS. And it works closely with the Social Security Administration and the Railroad Retirement Board. It's fun to know the history of Medicare. You know, it started way back in 1945 with President Truman. He was proposing a comprehensive insurance program for all people through Social Security. But it wasn't until 20 years later that something actually came about when President Johnson signed into law Medicare and Medicaid. Medicare being for people over age 65 and Medicaid being for people of lower income. And it's interesting to note that President Truman was the first person to enroll in Medicare. So later on in '72, disabled persons were included in the Medicare coverage, and also people with end-stage renal disease. And it was found that because Medicare had some gaps, that didn't, there were copays and deductibles, Medicare supplement plans were created. And in 1980, the government took oversight of those programs and made rulings regarding the Medicare supplements, as you'll see. Now, if we move the camera forward to most recently in 2005, Medicare created another program, and this time they contracted with private insurance companies to do it. And the goal was to create a more comprehensive, coordinated approach that would make it better for the Medicare beneficiaries in many ways. So we'll see how these different options work. So here they are, Part A, Part B, Part C, Part D. The first 2, Part A and B, fall under Original Medicare, and the second 2, Part C and Part D, fall under the new Medicare Advantage program. This is how they work. You have 2 ways of getting your Medicare. On the left is Original Medicare with the A and B that I talked about. You can add a drug plan. That's part of the new Medicare Advantage program. You can also add Medicare supplements that I talked about. Or you can go to the other side, which is Medicare Advantage. That's sometimes called Part C, and it combines Part A and Part B. You still have Medicare, but it's through Medicare Advantage. And most of these plans already contain the drug coverage built in. That's called Part D. These Medicare Advantage plans also have additional benefits like dental, vision, and hearing. But first, you have to start with Original Medicare before you go to any of these options. This is the famous red, white, and blue card. You'll see it has a Medicare number. That's the Medicare Beneficiary Identifier. That used to be filled with your Social Security number, but they don't do that anymore, and that's to protect your identity. So if you still have one of those old cards with your Social Security number on it, make sure you get one of these new ones and shred your old one. So who qualifies for Part A and B? We talked about people over age 65 who qualify. People who are under age 65 and disabled. Now, they must have been receiving their benefits for 2 years to qualify for Medicare. Also people with end-stage renal disease, and also ALS, Lou Gehrig's disease. How do you enroll? Well, it's automatic if you're already receiving Social Security or railroad retirement benefits. In that case, your Medicare would start on the first of the month of your birthday month. Let's say you turn 65 on the first. Well, then your Medicare would start the month prior to that month on the first. Again, if you have disability benefits, your Medicare would become effective the 25th month of your disability. But what if you're still working or you're not receiving Social Security benefits or railroad retirement? You'll need to be sure to sign up for Medicare through Social Security or the Railroad Retirement Board. It's not automatic, and you want to apply 3 months before turning age 65. Here are some important notes about Part B to add. If you have coverage through your employer or your spouse's employer, you may want to delay getting Medicare Part B. Be sure to check with your benefits administrator about this. Also, a very important note to add, if you retire or lose your group coverage and you need to get on Part B, be sure to do it right away. Any delay could cause a 10% penalty for you for every 12 months that you didn't sign up when you could have. So you really want to be aware of that. So there are 3 Medicare enrollment periods. One surrounds your 65th birthday month. It starts 3 months before you turn 65. It includes your birthday month, and then it includes 3 months after that. The second enrollment period applies to people who are retiring or are losing employer-based coverage. That's called a special enrollment period, and it's 8 months long. It begins the month after you retire. If you miss that enrollment period, there's an annual general enrollment period. It's the first 3 months of every year, and your Medicare would become effective July 1st. Keep in mind that 10% penalty for every 12-month period you were eligible but didn't enroll. So let's start with the alphabet. Part A. Some people like to think of A to trigger their memory for admissions, A for admissions. So we're talking about hospital, inpatient related services. Here they are: inpatient hospital care, rehab centers, long-term care in the hospital, skilled nursing facilities, etc. Please note that long-term care in a nursing home is not covered through Medicare. So insurance coverage generally has a premium, right? Well, for Part A, there is no premium if you or your spouse paid Medicare-related taxes while you worked for 10 years, at least 10 years or 40 quarters. Those were the FICA taxes that you paid. And when you get on Medicare, Social Security sends those dollars to Medicare. So, but let's say you didn't pay the 10 years of FICA taxes. You do have the option to get Part A by paying a premium. And in 2020, the premium can be as high as $458 per month. Assistance is available for those with limited income who need to do this option, but typically Part A premium is free. There are costs associated with Part A. In 2020, notice that I have that year in red because we'll be getting the new updates towards the latter part of the fall. But in 2020, the hospital deductible is $1,408 per benefit period. A benefit period equals 60 days, so keep in mind, in a worst case scenario, there could be 6 benefit periods in a year. Let's say you had a really challenging health year and you were in the hospital over 60 days. You could also have copays of $352 per day. And even longer still, if you were in the hospital past 90 days, the cost goes up to $704 per day. So please keep that in mind. And once you've hit your 60 lifetime reserve days, Medicare pays nothing. So it's important to keep those risks in mind. Let's go on to Part B. You could think of B for Band-Aids, outpatient, medical services, sometimes called medical insurance. It includes things like doctor's services, outpatient care, home health, preventative care, durable medical equipment, all these different outpatient scenarios. Now in 2021, we just got word that several new things are included: acupuncture for low back pain, telehealth visit with providers, virtual check-ins for follow-ups. Now, these are limited and there are qualifications, but they are new things that are coming aboard with Medicare coverage. There is a premium for Part B, and most people, at least the 2020 premium, is $144.60. Those with higher incomes will pay more. They can pay as much as $389.80 per month for Part B. Once again, those are 2020 figures. These premiums are based on the income reported to IRS 2 years ago. But people with limited incomes who are receiving assistance will pay a lesser amount based on the level of assistance they receive. Now, keep in mind, you also have that 10% penalty for every 12-month period you were eligible but did not sign up for Part B. And there are additional costs related to Part B. The deductible is one time per year for Part B, and it's $198 in 2020. After that, it works like an 80-20 plan. Medicare pays 80%, and you're responsible for the other 20%. So we learned something. Medicare covers a lot, but it doesn't cover everything. So let's look at what was another option that came aboard, Medicare supplements. Medicare supplements are sometimes called Medigap plans. It's supplemental health insurance that covers some or most of the costs that Medicare doesn't, those copays and deductibles. It's provided by private insurance companies. And you may wonder why I have this illustration of apples stacked up. Well, it's because Medicare regulated the plans and created a standardization of plans so that you could compare apples to apples and see how they stand up next to each other. So these are the plans side by side. And again, they used letters, which makes it confusing. These aren't Part A, these are Plan A, etc. And until recently, Plan F has been a really popular one because it covers everything. But starting in January 1 of 2020, people who are becoming eligible for Medicare don't have access to a Plan C or a Plan F. Keep in mind, if you were on Medicare prior to January 1 of 2020, you can still get a Plan F, or you can keep your Plan F. So right now, a popular Medicare supplement is Plan G, which covers everything except the Part B deductible. Now, these plans have a monthly premium, and they're generally about $100 per month to get started, and they go up from there. So here are the costs. Your monthly premium is paid to the insurance company. Keep in mind, you continue to pay the government for your Medicare Part B. The cost varies by carrier, and it depends on the plan you choose, where you're located, and how old you are. The premiums go up over time and also as you age. And if you decided you needed to change plans because the premium has gotten kind of high, health underwriting is usually required to change plans. So the enrollment period, there is one open enrollment period to apply for Medicare supplements. It begins the first day of the month you are eligible for Part B, and it continues for 6 months. There's a guarantee issue situation because you can't be denied or charged more because of a pre-existing condition. And you must have Part B to obtain a Medicare supplement. There are limitations to Medigap plans. They don't cover long-term care in the nursing home. Then they don't cover things related to vision or dental or hearing aids or eyeglasses or private duty nursing care. So we looked at Part A and Part B of Original Medicare. We talked about Medicare supplements that can help cover what Medicare doesn't. But let's go on to the new option, relatively new option of Medicare Advantage. It includes Part C and Part D for prescription drugs. These again are the two ways you can get your Medicare. So now we're focusing on the right-hand side of the panel, Part C, which combines A and B, and oftentimes has Part D built in and includes other benefits. So think of C for company. These plans are provided by independent insurance carriers. Here it is, offered by private insurance companies who are contracted with Medicare. The insurance company pays the claims rather than the government. Medicare still approves the plans, and the plans can change each year. These plans through Medicare Advantage must cover everything that Medicare covers, and they may include additional benefits, and these vary by plan. Most of the plans include Part D prescription drug coverage. So there are costs involved. Let me go back to that, sorry, this acted strangely. You still pay your Part B premium, and you may have an additional monthly premium, and you will pay deductibles, co-insurance, and co-payments. But the premiums are low to oftentimes zero. The deductibles are low and oftentimes zero. Most of these plans include drug coverage. There's predictability built in, and you have an annual out-of-pocket maximum, which protects you against having outstanding Medicare costs. Additionally, the MA plan benefits are often included, which are things like vision, dental, hearing, transportation, gym memberships, even meals after a hospital stay. And in the Austin area, we're really lucky because we also have an added level of care coordination provided through Connected Senior Care Advantage. So there are different types of Medicare Advantage plans. We have HMOs, which are health maintenance organizations, and they have a tighter provider network. You need to stay in network unless it's an emergency. Oftentimes you have to have a referral before you can go see a specialist. We also have PPOs, which have a network of providers, and you can choose to stay in the network and save money, or you can go out of the network at a higher cost. We also have private fee-for-service plans, which allow you to go to any provider as long as they accept the plan's terms and conditions. There are also special needs plans for people with chronic illnesses. And then MA plans don't include drug coverage, and they work well for veterans, and they don't interfere with their other benefits through the VA. So who can generally join these Medicare Advantage plans? You have to have Part A and Part B. You need to reside in the plan's service area. But the beauty is you can join even if you have a pre-existing condition. And this is new for 2021. Even end-stage renal disease patients can enroll in a Medicare Advantage plan. So that's big news for 2021. Keep in mind, you can only belong to one Medicare Advantage plan at a time, and it is illegal to try to have a Medicare supplement at the same time you have a Medicare Advantage plan. Moving along the alphabet, Part D, think of D for drugs. These plans are also called PDPs. They're approved by Medicare, and they're run by private companies. Again, the plans change every year, and there are two ways to get this coverage. You can get a standalone plan, or one that's built into a Medicare Advantage plan. So, to be eligible, you must have Part A and/or Part B. You need to live in the plan's service area, and you have to be enrolled in the plan before you get coverage. And you can't live outside of the US or be in prison. So there are premiums for Part D. They vary by plan. I've seen them be from as low as $8 a month and all the way up to $50 a month or more. If you have higher income levels, your premium may be higher, and those are computed by looking at the same thresholds that we look at to determine your Part B premium. Also, if you wait to enroll, it's like Part B. If you wait to enroll, you could have a penalty of an additional 1% of the base beneficiary premium. And in 2020, that base premium was $32.74. So this is added for each month you were eligible but didn't enroll, and it stays in place as long as you have a drug coverage plan. So there are Part D costs, and the costs vary by plan. Each plan has their own formulary, and in that formulary, the drugs are placed in tiers from different levels of generic drugs all the way up to brand name drugs. And a new addition for 2021 are plans that are participating in a Part D senior savings model. This creates a $35 cap on copays for certain types of insulin drugs. And these new savings models will be available through participating plans starting in 2021. So the costs related to Part D in 2020, now these figures may change going into 2021, but you normally pay a premium unless it's included in their MA plan. They have an annual deductible, which can range from $0 to $435. Once they've paid that deductible, you go into an initial coverage stage that includes co-payments and co-insurance. Then after that, you get into the famous donut hole. And this has gotten better over time. Now in the donut hole, what you owe is 25% of the covered drugs prices. Now, once in a while, someone can reach a spending limit of $6,350 out of pocket, and that puts them in catastrophic coverage, in which there's very little spending for the member. And really only about 4% of people make it to the catastrophic stage. So looking back at Part C and Part D, there are Medicare Advantage enrollment periods you need to be aware of. There's the initial election period, which surrounds your birthday month. It's that 7-month period, 3 months before, including your birthday month, and 3 months afterwards. Then there's the annual enrollment period, and that happens every year from October 15th through December 7th. And that's the time when you can shop around, you can pick a Medicare Advantage plan, a drug plan, you can change your mind. But what you decide to do, the last choice you make before December 7th is the one that sticks for January 1st. So you want to make sure you're making that correct choice for you. Now, let's say January 1st comes along and you're not too sure about your choice. During open enrollment period, which lasts the first 3 months of the year, you can make one change. And this relates to Medicare Advantage plans. You can change the plan, you can change your drug plan, or you can go back to original Medicare, but you only have one choice during that time period. Now, the last enrollment period is the special election period, and there are several different types of special election periods. You can use one that relates to change of residence, loss of group coverage, or if you're on Medicaid, you can do this more often. So those are available in certain circumstances. So again, there are 2 ways to get Medicare. On the left, we discussed original Medicare. You have Part A, which is usually free. You have Part B with that $144.60 premium for 2020. You can add on a drug plan, which can range from $8 to $50 and up. And even if you don't take prescriptions, you want to be sure to get on a drug plan when you're eligible. Otherwise, you'll have those penalties later down the road if you decide to enroll. Again, on original Medicare, you can add a Medicare supplement. Or we can go to the right side, Medicare Advantage plans, the right side of the page, which are often called Part C and Part D. Part C combines A and B. It's kind of bundled together most of the time, including your Part D, which is built in. And it also includes additional benefits such as dental, vision, and hearing. So, as we can review again, Medicare is complicated. It's confusing and it's concerning. So that's why we advise you get some help. You know, during this presentation, you'll have seen a number to call. And those are our call center people with a team of agents who have your best interests in mind, and they can help guide you. Now, if you would prefer to have someone local help you, you want to be sure to ask for that. We have a team of local agents here in the Austin area, and their mission is to help you find the Medicare solutions to fit your individual needs. They're independent agents. They represent all the carriers that your provider accepts, and they're ready to help you. They can become your agent for life, so you can ask for these folks. And now we're going to open it up to questions, and I appreciate you listening in.